In your morning headlines today, Vanderbilt University Medical Center is under review after a nurse accidentally gave a patient a deadly dose of the wrong medication. It happened last December. The 75-year-old patient was scheduled for a PET scan and asked for medication to help with claustrophobia. The nurse was supposed to give her a drug for anxiety, but instead, the nurse gave her a deadly dose of a drug that causes paralysis. Both medicines start with the letters VE. The patient suffered cardiac arrest and died in the following days. The hospital nearly lost Medicare funding. The Centers for Medicare and Medicaid Services launched an investigation and surveyed the hospital earlier this month. It finds, quote, the hospital failed to ensure all patients received care in a safe setting and staff followed standards of practice. The hospital was forced to submit a plan of correction to prevent similar errors in the future. CMS says it has accepted the plan. There's no word yet on if the nurse was disciplined.